So I'm Lynn Kinst. I'm the Executive Director of the Hemophilia Council of California. I want to welcome you to our Advocacy and Public Policy webinar today, Navigating Your Care and Treatment, a Medicare Example. No, that's great. And I think two quick take-homes that I really want to emphasize from both what Randy shared and from what you've shared, Marla, is make sure that you are planning for this ahead of time. Like, when the birth date is coming and you're turning 65, and make sure you really find out like what is happening with any sort of, union or employer coverage and how that's going to convert over, and and do all of this ahead of time and really watch these dates, because it can work seamlessly, like Randy is saying, but if you don't elect the proper coverages at the proper time, it can be a big mess that is very difficult to untangle later. And I know Marla and I have spent time on the phone trying to help people untangle messes from situations when they didn't elect things timely or they got bad advice. So really rely on the resources that we're talking about to make sure that you get good advice. And also, to some degree, the advice that you're seeking is only going to be good as you sharing the proper information. So if you call one of these state places to get advice on what you should be electing, and you don't tell them, I have a bleeding disorder and I know that factor that what I am treated with is covered under Part B, then their advice is not perhaps going to be as good for you. So you need to make sure you share that pertinent information when you call them. So we did have a few questions, mostly related to Medigap. So I'm going to run through them real quick. Thank you for staying on the line a little bit longer, folks. Hopefully these answers will be helpful to you. Will Medi-Cal provide supplemental coverage?
Yes.
Does it basically act as a Medigap plan in that sense, then, if someone qualifies for Medi-Cal? Correct. So and it's not at all uncommon for people to be covered under
Medicare and Medicaid.
Right. So in our case here in California, that would mean that you have Medicare and Medi-Cal. How much do Medigap plans typically cost? I know there's a range. I know it's a range. There's not just like one price, but do you have a general?
I do, and that I also included a fact sheet. I don't know what it's called. CMS publishes fact sheets for each state. So the average. Did you say Medigap or Medicare Advantage?
They were asking about Medigap.
Okay. Hold on. Maybe Part D. I don't, okay, because it's complicated, and that's not a nice answer, but it is, right? Because they have to determine how many, which plan you're talking about. So I think the costs are very
wide ranging. Yeah.
Yeah.
Okay. So there's
but
not
for example, let's just say Medicare Advantage, which bundles everything, the monthly premium is $18.
Okay. So there's a pretty range from things that are very affordable and then on up potentially. So we also got to know if you're rejected by Medigap, like say you don't get in that 6-month window, what can you do? It seems at that point the only option would be an Advantage plan.
Correct, because, or not necessarily, right? You should have something to cover the remaining 20%, but you also need Part D, right? So your Advantage plan, or, if you have employer coverage, then you wouldn't need it like Randy has, or if you have union benefits, or a pension plan, or it's not called a pension plan, retiree benefits, or then those will act like a Medigap plan. So you wouldn't need it, in which case then,
So there's a number of options there for people, and Medi-Cal in California could be an option.
If your income qualifies, yeah.
If you qualify. And then the last question is also sort of related to that, is GHPP, and I don't know, this is a very California specific.
No, question. I know the GHPP program, genetically handicapped. It has a program, right? But is that still the payer of last resort?
It is. So I think so they're asking if it would act as a Medigap or a supplemental plan. And I do think that we have cases of people in California who I don't know that you would necessarily want to do that in lieu of, having an Advantage or a Medigap if you have that option still available.
Yeah.
But it is possible that I do think we have cases of people who have Medicare and then they also have GHPP. And if you have, for example, you could theoretically even have all three in California, where you have Medicare and Medi-Cal and GHPP. But GHPP in that instance would, like you say, always be the payer of last resort. So it would, and I don't know necessarily that it's going to pick up much at that point that isn't already picked up by Medicare and Medi-Cal.
Correct. And let's remember that GHPP is a limited line item budget in that it has like it's not an unlimited funding, right? And presumably if you're on Medicare and over 65, you're going to be on there for a while, hopefully.
Right. So those were, I think, all of the questions that popped into the chat. Before we get off, and I'm amazed because pretty much almost everyone has stuck with us. Is there any other questions that anyone has that they did not get the answer to and they want to unmute and ask a question before we wrap up? This is all really helpful information. Again, just want to encourage people, please plan early.
Please, and ask your
questions.
question. No question is too, like Medicare, it works really, really well. But Medicare has its own protocols and procedures for everything. And I just want people to really let that, appreciate that and let that sink in. And that if Medicare says you must pat your head and rub your tummy at the same time while doing it, Medicare really wants you to do that. Like Medicare will not pass go. You cannot collect $200 until you do exactly what it is they say. It's not up for debate whether or not you agree or disagree with their protocols and procedures. It's just those are how Medicare laws are written. And it is also the one big take-home thing, and I wanted to mention this, is that remember when I said there were deductibles and co-pays, and remember if you're going to live on a fixed income and if you're retired on a fixed income, those little things, whether it's $200 annually, add up over time. So you really need to sit down and think about what are the costs and what can I afford and what is the best use of my.
I see we have a question, a hand raised. Did you want to unmute and ask your question?
Yes. My question was just, do you happen to know if TRICARE for military retirees would follow as one of those Medigap plans?
I would imagine it does, because I do think it, because there, yes, I'm going to say yes, but I would definitely need to verify that. I believe TRICARE VA both qualify, for, it's definitely on the list, and I could.
That would be my assumption as well. I just haven't looked into it.
Yeah. I would absolutely say yes, but I just, you may want to shoot me a quick email to remind me to look it up, because it takes 2 seconds for me to look up. Like it's in the Medicare handbook, what qualifies.
Right.
So if you have access to the handbook, the 2020 coverage that I showed on the front, it's in there. But I could also look it up as soon as we get off. Just remind me.
So Marla's email's right there on the screen. If you want to
Yes.
grab it real quick, you can shoot her an email.
Yeah,
and then thank you for that question. There was one more question that just popped into the chat. It says people on Social Security are eligible for Medicare after 2 years. This would be people on Social Security for disability reasons as opposed to age reasons.
Yeah. Mm-hmm.
Does Social Security automatically enroll at that 2-year mark, or are dates something that you need to keep on your radar in terms of like meeting an application time period?
I always err on the side of caution in that I keep dates on my radar all the time, right? Because if you say, like I just said to the woman who asked the question, just send me an email, because there's a fairly high probability that I'm going to log off of this webinar and forget that someone asked me a question, right? So in theory, they should enroll, but you have to elect to enroll in Part B, right? Like, so you will have to make an active selection at some point, and you will have to alert them, because Social Security, that's why I sort of open with the two agencies at the front, is that they don't always talk to each other very well. Like, well, Medicare does all the legwork, right? Administering and design and what have you. They don't always talk to Social Security, so I would absolutely keep it on your radar.
So in theory, they should automatically enroll in Part A at the 2-year mark, but you're going to have to make an election about Part B and any sort of gap coverage that you want to obtain. So therefore, it would be good to plan to mark that on your calendar and follow up, make sure you get the paperwork and submit it in a timely fashion to make sure that there's no issues.
Because and it also, if you want to or you probably, or maybe qualify for Medi-Cal at that point. But I mean, because you'll also want a supplemental, but you will have to enroll active, and it's called active enrollment in that you select them.
Excellent.
Because there are payments.
Good. All right. Well, I think those were all of the questions. Marla, thank you so much. This was super informative and helpful. I want to also thank Oh, go ahead.
Sorry, before you thank the sponsor. So you'll send out the open enrollment in California 2022 fact sheet, as well as the slide deck, correct?
Correct.
Because there's a lot of really great, it has a link to the handbook. It has all these important dates and deadlines and when things start. It gives you a lot of specifics to California about the Medicare Savings Program and the number of plans offered in your state and what percentage, blah, blah, blah. So
yeah, we'll send that out to everyone who registers.